Non-tunneled central line care, dressing and blood taking. Introduce yourself to the patient, explain the procedure, gain consent, and check allergy status. Position the patient appropriately, semi-recumbent or supine if possible. Check vital signs and documentation for non-tunneled central line. Decontaminate hands according to the WHO 7-step approach. Don plastic apron and non-sterile gloves. Decontaminate dressing trolley with alcohol wipes. Remove apron and gloves and decontaminate hands. Place all equipment according to the number of lumens on the bottom shelf of the clean dressing trolley. In the following clip, we will demonstrate the procedure for accessing 1 lumen. The equipment required for this is as follows: sterile dressing pack, sterile gloves, 1 by 10 ml syringe, 1 by 10 ml Posiflush, 1 by 70% alcohol in 2% chlorhexidine green kernel wipe, 1 biopatch, 1 needleless connector, 1 ChloraPrep, 1 dressing, 1 access device, and 1 blood bottle. See equipment required for a 3-lumen or a 5-lumen non-tunneled central line. Take the trolley to the patient's bedside and decontaminate hands. Open sterile dressing pack and place all equipment onto the sterile field adhering to ANTT. Decontaminate hands and apply non-sterile gloves to remove the old dressing. Remove dressing toward the point of entry. Discard old dressing, assess site, discard gloves, decontaminate hands. Don sterile gloves. Place the sterile field under the non-tunneled central line. Exercise caution when moving central line due to sutures. Prepare ChloraPrep applicator by holding downwards and pinching the wings between your thumb and forefinger. Ensure solution enters foam applicator pad. Clean site for 30 seconds in a hashtag manner starting at site entrance and moving away. Then allow to dry for 30 seconds. Discard ChloraPrep into Sharps box. If biopatch was removed, reapply now using ANTT. Apply sterile, clear non-permeable dressing such as an IV 3000, molding it into place so that there are no folds or creases. Ensure lumen is clamped. Remove and dispose needleless connector. Take 2% chlorhexidine in 70% alcohol wipe and clean the lumen hub for 30 seconds and allow to dry for 30 seconds. Apply new needleless connector. Ensure the lumen is clamped. Connect 10 ml sterile syringe. Unclamp lumen and withdraw 3 to 5 ml as per organizational policy. Apply clamp on lumen, remove and dispose of syringe. If you encounter resistance whilst withdrawing blood, stop procedure and refer to appropriate member of the MTT. If taking blood, apply a suitable blood access device. Unclamp lumen and apply blood collection tube. Invert blood collection tube 3 to 4 times. Ensure lumen is clamped before removing blood access device. Apply Posiflush or 10 ml of 0.9% sodium chloride solution and unclamp lumen. Flush lumen using a push-pause technique. When pushing the final 0.5 to 1 ml, ensure positive pressure is applied to the end of the syringe whilst simultaneously clamping the lumen. Continue procedure with remaining lumens commencing with proximal and ending with distal. Apply line labels in accordance with the regional line labeling policy. Dispose of all waste appropriately. Remove apron and gloves. Decontaminate hands according to the WHO 7-step approach. Ensure the patient is comfortable. When taking blood sample, ensure positive patient identification and label the blood collection tubes and laboratory forms at the bedside. Complete documentation accurately